Hello everyone, my name is Chuck Hamilton and I'm the Chief Innovation Officer of Mshaped. I'm also an Executive Advisor to Venture Labs located in British Columbia, and I'm also an Executive Advisor and partner with InoCrowd, which is a crowdsourcing and open innovation platform based in Portugal. And we collaborate all the time, and recently the CEO of InoCrowd, Soraya Gaddit, asked me if we might want to work together on a COVID-19 project. Essentially, what we're trying to do, or what we see happening, is that we realize that everyone concerned with this virus and its spread across the globe is heads down, doing everything they possibly can. Our best people are working night and day to try and stem the tide of this virus. And there is little time for people to collaborate on best practices that may be happening in one location that may not even be heard about in another location. So we decided we would consider some of these best practices and maybe put them in a little bit of a framework for discussion, and then see where there might be some deeper areas of collaboration that we could go after and share them wherever we could. So in an effort to share what I saw going on, I put together a little slide deck that accompanies this video. And I put a little framework around that for dealing with the types of things I see that there might be some greater collaboration points to go after. There are really four categories that we were taking a look at. The first is testing, both rapid testing and scaled testing for coronavirus. And there are a plethora of testing options going on, as well as a lot of data being collected on what's happening. And I want to just make sure everybody's seeing what I saw out there. The second area is around traceability. Essentially, if you have contracted the COVID-19 virus, and we can go back into your trail of where you have been and what you have done, so that we can maybe help other people or stem the tide again in your trail. The third category I took a look at was everything to do with virtual work. Essentially, there are a plethora of virtual work tools, everything from meeting and gathering and tools for video collaboration. But there's also a lot of tools and techniques being developed for virtual medicine and teledoc, telehealth type of activities, remote clinics, all of which can be very valuable in helping people stay away from clinics when they don't need to be there, and therefore helping to spread the disease. So I wanted to explain and see some of the tools and technology that I saw going on there, as well as some of the companion equipment and materials that go with that. The fourth category I took a look at was around social action, communities of practice, community action networks. These are areas where people are coming together on the web in various forms, in various communities, local, international, to try and do something collaboratively for social action for good. There's everything from making new equipment to social networks for mental health. And I thought we should share some of the practices we see going on, and see if they can't be reused and applied. So remember, this isn't about claiming expertise in all of the areas I'm discussing here. It's really about just connecting ideas, connecting threads, showing somebody something they may not have seen. Someone in Singapore, someone in China, someone in Portugal may have seen something that we haven't seen, and vice versa. All of you go out every day to the mall or to your work or to what you do, and maybe see a best practice that should be repeated and could be helping to stem the tide and stop this virus from spreading further. So your idea may help somebody live, and that's really what we're trying to do. So if you have an idea, feel free to email it to me at chuckforcovid19 at gmail.com, or you can hashtag it at techforcovid19, and we'll find them and put them up. Thanks for looking at the video. Take a look at the slide deck that accompanies this piece with the curated list that I prepared. And we'll see you again soon.